Do this one first, just a small amount.
Okay.
So this is
Everywhere?
just a small amount. This is the anti-aging peptides. We're just going to put this as a base of solution, so that you get some slick area. Perfect. So now you can save that for later, and then now we'll go to the other. So now she has a nice coat of multiple peptides for anti-aging. This is really collagen production. Now it's not going to do that much just sitting on the surface. So we're going to microneedle that in, but at the same time, what I want to do, you okay?
Mm-hmm.
Strong. Okay, go ahead. So now what she's going to start putting on the BioFlash, which are our combination of vitamins. Oh, need a little gauze. Keep your eyes closed for a second. Guys, give me some gauze.
Ashley? Gauze. Yes.
It's okay. We'll get it out of your eye. Don't worry. It's not going to hurt you. So do, a little bit. It might be better to put a needle on the end, and then you can get it out of the needle. Go ahead, just with this. Keep your eyes closed. There you go. So now we're just going to stimulate some microneedling. Are you guys live yet or no?
Yeah.
PJ, come closer. I want you over here. Real close. All right, so go ahead, do the small bits. So follow me around. So she's going to keep putting on a little bit of the BioFlash, which is numerous vitamins and minerals for the skin. You always tell people you got to feed your skin, you got to feed the cells. So the peptides for anti-aging and then the vitamins for growth. But because she does have some hormonal pigmentation that you can see on her, under her eye and cheek area, lateral cheek, we're going to go back and do some of the depigmentation solution in a minute. You can go ahead, wherever you want to go. I'll watch you. How are you doing with the pain?
Mm-hmm.
It's fine. Good. You're doing fantastic. Everything looks great. So again, you guys, look. Light pink. Starting to form. That's exactly what we want. Nice even strokes with the microneedle. What's nice about the M-Pen is it's very, very gentle, and it's very suspensionary. When you press, it bounces back, so it's soft, so it protects the skin. Okay, you can keep going. Switch with me a sec. I'll let you go over there. I'm going to keep going on this side. Right now we're doing a 1 millimeter because she's pretty strong. After we've done a little bit of the horizontal and vertical passes, we're going to do some rotating passes. She's a great sport. Turn your head left. I want them to do more on the cheek over here. And a little wet, more wet. Great. So we're going to get those vitamins in there. And this is just to make the skin glow. This is like, again, feeding your cells. Now, she has a little acne here. Let's pop that guy out. Look, see right there? It's popping out. Open the cyst. Get that guy. It's all gone. Perfect. Good. And keep going. You can do the other side. Yeah, go ahead. Now we're going to put on some of the depigmentation solution. That's the tranexamic acid and the niacinamide, anti-inflammatory and anti-pigment. You would be surprised at how quickly the depigmentation solution works when you inject it topically, which is what superficially, which is what we're going to do. Any questions so far? Any on social? No. Can you come around here, Peach, on this side of her? So I want to show everybody up close. Turn towards me now, and she's gonna keep pushing on that solution. Just put a little bit more. We're gonna go over the pigment area a little bit more, and she's gonna put some of the depigmentation solution right there. We're gonna push that tranexamic acid in there. And again, the other key is just go under the eye. You really want to get close there. Get a nice tightening effect. Go over there softly. Get the nose, so you can get a lot of the pores. Doing really well. Maybe go a little bit stronger. She can tolerate it very well. Even strokes all the way throughout. A nice glide is what's important. Now, you don't want to do it too hard because she's very slim. If you do too hard, you can leave her with blood vessel dilation and petechia. We don't want that. we basically have covered everything. So we're going to let them put the rest of the solution on. Get any more of that cyst that she had out. Perfect. And then we're going to okay, that's all gone. Okay, now we're going to switch to doing 1-in-1 with the bioflash and depigmentation. I'm going to inject. Yeah. Now you can see a light pink, very fine pink pinpoint bleeding. And then I'm going to use that one too, the peptide.
Okay.
I can use that to start if you want. Just give me the small needle, not the 32. We're going to do blebs.
That one?
The 4 mm. No, that's the 30.
Here you go.
Now what we're going to do, because we want anti-aging for her, we're not going to even focus on the pigment, strictly collagen production. She doesn't have that much wrinkling, but yeah, just try. So right in here, there's a clear solution, small baby needle. Okay, leave that here. And we're going to do a grid pattern, okay? Little pinches. You'll be okay. It shouldn't be too bad. Are you okay?
Mm-hmm.
Okay. Little grid pattern, okay? Small bits, nothing crazy. Just along her central space. She's doing great. And it's just to give her some anti-aging benefits. Only needs to be every few centimeters. I'm just going to do it straight down her cheek. This is really great on the neck, actually, for women that have a lot of looseness in the neck or neck wrinkles.
I need that.
It's really good with that, combined with the matrix. Doing great. One more pass, okay? One more little row. You can see here a lot of little baby injections, just like that. You okay?
Mm-hmm.
Good. Should be a little bruised tomorrow, not crazy, but a little bit. But the goal is to get these peptides under the superficial surface, and I want to flow that a little bit also under her melasma, which we're doing right there, and a little teeny bit under her eye for rejuvenation purposes. Good. Okay, so that's great. She doesn't have any wrinkles around the mouth or anything, so there's nothing we really need to do there. So I'm going to give you this to hold just on this side for a sec. Turn to the left. Can you give me one more gauze? We're going to do that same thing. Thank you. Over here, we're just going to do slight baby injections right under the eye. You can see the little baby blebs. Okay, you see the little blebs? Great. And then every few centimeters. Doing great. We're just following a little grid pattern where I really want her to get some anti-aging. Yeah, it's just superficial pumping. This is anti-aging. This is numerous collagen production peptides, so sometimes for tightening a little bit, but you could use the tightening solution. And then what I want to do is switch this now to the 30 gauge needle for me. No, to that one. Yeah, just switch that to the 30 gauge. And we're going to nappage the whole cheek. Perfect. So now what we're going to do, we have that little teeny baby bit left, and I want her to get a lot of anti-aging from it. So we're just going to go straight down her entire cheek area. You see the little balls, the little superficial raindrops. That's exactly what we want. Her skin's gonna look just super plump. You okay? Okay. Trooper. Okay, great. What we want to do is you don't want to wipe that off. You want to rub that in. Okay. Rub that in. Great. Now, turn to the other side. I'm going to take that away. Good. And do that same thing. We're going to do the massage technique. Right across the skin, little superficial injections. This works also for cellulite and skin tightening. Unfortunately, you get a little bruise sometimes, but skin looks amazing after. Doing great. You see the little dots? That's exactly how we want it to be.
Just squirting the medicine?
Very little bit, yeah, very little at a time. We already injected under here, so we don't need to do as much. And down the edge here. Perfect. Great. Give that to that. Now, lastly, I need the depigmentation. Is there some mixed with bioflash, or is it just bioflash alone? Oh, perfect. Exactly what I need. So now last but not least, we're going to take a little teeny bit of the depigmentation solution in the bioflash. We're going to go right over the pigmentation areas. With little blebs all across the pigmentation areas. Okay. She's doing great. Okay, just like that. Anything on Insta?